Hi, welcome you all for the KNO classes. This is your Nagraj, NORCET mentor and NORCET guide. We are running a smart PIP preparation series for NORCET 9, and our team has been trying to struggling to give a high content and MCQs for your NORCET preparations, and we are running so many test series. Okay, we are running the NORCET 9 mega test series that includes your MCQs. The subject wise and a high yield topics videos also freely available on our KNO app. Just take a series and try to solve maximum number of questions. When you try the questions, when you try to attempt the MCQs, when you solve the MCQs, your brain reflex, okay, your brain reflex will be improved, and you can able to attend the examination. In main examination, you can able to solve questions very easily, and you can increase your strike rate by applying the where you gain the knowledge while solving the test series. So test series solving is very important. After reading the theory concept, you should always try to do the maximum number of questions. At least during this NORCET, during this peak period, you should solve at least 100 to 150 questions. You should solve per day. Apart from your revision, apart from your theory studying and all, you should do a maximum number of MCQs. You should solve. So we are running the KGMO and SCPJ booster series and RRB smart preparation series. Okay, that will be valid up to your RRB examination. So try to get the RRB and NORCET 9 mega test series and try to solve the questions and watch our videos on our KNO app. So in this video, we're going to deal with the topic called as a biochemical test. Okay, important biochemical test. You should must know important biochemical test for your NORCET 9. So in this video note, I made you concise. Okay, I made you concise in a one liner. I will try to give maximum number of tests done in a hospitals, and a laboratory test will be known in this video note. So if you see, biochemistry is also an part of our nursing subject, a part of nursing curriculum. So it is considered as most neglected topic. Nobody will try to study the biochemistry during NORCET examination and all. But if you see, like in NORCET, they may ask you one or two to three questions. They may ask you related to the biochemical test or a clinical test which are done in a hospital. So you should know. You should know. Like in a single video note, I'm going to cover your whole biochemical test and other tests related to the medical surgical nursing. So welcome to the classes. Without delay, we'll start the session. We'll take the forward to the session. I told you in the video note, I'm going to give 50 to 40 tests which are done. So going to the classes, first test. Okay, first test which is done in hospital. Okay, so that one is a sick test. Okay, sick test. I think all of you know that what the sick test actually does means. It's which is okay. Here is one question showing that sick test is done to diagnose of for what diagnosis they will do a sick test. Measles will not do a sick test. Measles will do a RT-PCR for checking the for checking the virus load, and rubella will do IgM and IgG antibody, and mumps will do the same IgM and IgBD, and urine PCR test will do for the mumps. But only diphtheria will do the antibody test. That is sick test. What you will do in that? Mainly, what we'll do? We'll take the toxin. We'll take the 0.1 ml of 1 ml of diphtheria toxins. Okay, we'll take the 0.1 ml of diphtheria toxins. How we are going to perform this test means 0.1 ml of diphtheria toxins. Diphtheria toxin is taken in a 1 ml syringe. Taken in a 1 ml syringe. It is injected into the forearm into the. It is inject the diphtheria toxin into the skin. Injection of diphtheria toxin. I'm writing here diphtheria toxin intradermally, and try to observe the site. Try to observe the injection site for arrhythmia, for arrhythmia, induration. Watch the site carefully. After 24 hours, if you are getting the agglutination reaction, if there is an induration, if there is an arrhythmia present, you should measure that arrhythmia site, how much it is, whether it is 2 mm, whether it is 3 mm, whether it is 5 mm. Based on that one only, we can able to get whether the patient is having already prepared antibodies for the diphtheria or not. This is the test, like this is how we're going to perform this sick test for confirming the diphtheria. Second test will be Adam test. Second test is named as Adam test. When you will do Adam test is done to diagnose the scoliosis. Scoliosis is a spinal deformity, spinal curvature deformity. For scoliosis, they will do a Adam test. Adam test is also called as forward. Forward means आगे forward bend test. Okay, also called as forward bend test. What we will do here, if you ask me, means I'll tell you. If in the Adam test, what we will do, we will tell the patient, to bend forward, and after bending forward, we'll see the spinal curvature from the back side. If the patient is bending the spinal curvature, if spinal curvature is bending, lateralizing towards the right side or left side, means we call that one as scoliosis. Lateral curvature of spinal cord is called as scoliosis. Here they written deformity from scoliosis. What deformity it is? It is a spinal curvature deformity. It is an a scoliosis is a spinal curvature deformity. It is a spinal curvature deformity. And other spinal deformities also there. One is kyphosis. Kyphosis is nothing but hump, buffalo hump. Kyphosis, it is a thoracic spine deformity. Actually, it is a kyphosis and thoracic spine deformity. And one more deformed spinal deformity, that is lordosis. Lordosis means it is a lumbar spine deformity. It is a lumbar spine deformity. Kyphos, whereas in kyphosis, it is a thoracic spine deformity. Thoracic spine deformity. But if you see scoliosis is a lateralization. Okay, lateral curvature of the spinal curve is called as scoliosis. For testing this one, we do Adam test or forward bend test. Here I'm written here. Okay, forward bend test, also called as forward bend test. All of you clear that? What do you mean by exactly the Adam test is? Now, third one, aldehyde test. What does actually aldehyde test means? Aldehyde test means it is a chemical reaction. Okay, chemical test done for the leprosy. Done for the leprosy. For diagnosing the leprosy, we'll do the aldehyde test. If you see leprosy, Mycobacterium lepra is very difficult to culture. For culturing leprosy, Mycobacterium lepra is very difficult. We will not get the medium for growing the Mycobacterium lepra. So that's why what we will do, we'll do aldehyde test. What we will do in an aldehyde test, we'll take a sample from the like lesion, where the lesion will be, granulomatous lesion, or else maybe it can be like a neurovascular lesion. We'll take the lesion, and after that the lesion will be mixed with the aldehyde reagent. Aldehyde reagent. Plus that lesion of the leprosy, and then we'll see for the reaction. If reaction is positive, we call that one as positive lepra reaction. If negative reaction is there, means consider as leprosy is negative. And fourth one will be your very important test done in case of H. pylori infection. That is your urea breath test. Urea breath test done in H. pylori. H. pylori infection. They will do a urea breath test. H. pylori, what it will cause? It will cause the gastric ulcer. What it will cause? It will cause the gastric ulcer. Peptic ulcer disease, PUD, and duodenal ulcer, and gastritis. These all are the disorders caused by the microorganism called as H. pylori, Helicobacter pylori. And if you see what does actually, how does this test is performed, means we'll give the test, we'll give the radio labeled, or else plain urea. We'll give the urea to the patient, labeled urea. We'll give the labeled urea through mouth. Then we ask the patient to swallow. After swallowing, what will happen? The patient will swallow the urea. After that, what will happen? The H. pylori will convert the urea into carbon dioxide. We'll convert the urea into carbon dioxide. So how we're going to check the carbon dioxide level? We'll tell the patient to exhale the breath in a paper bag, and then we'll measure the carbon dioxide levels in a exhaled breath. If it is exceeding more than a 45, more than a 55 means it indicate more carbon dioxide present in a breath air. That is a positive urea breath test in case of H. pylori infection. If H. pylori is not there means that the urea will be eliminated through the urine or the feces. So that's what your urea breath test. And now we'll see like fifth biochemical test. That is your phosphate test. Phosphate, P for phosphate, P for pasteurization. P for pasteurization means it is an reaction. It is a reaction. Where will do pasteurization? Pasteurization is done for eliminating the bacteria. Okay, eliminating the bacteria from the milk, from the milk and dairy products, milk and other dairy products. So if you wanted to see the pasteurization means eliminating the bacteria or pathogen from the milk and dairy products is called as pasteurization. Through the phosphate test, we'll check the pasteurization process. Here, what we'll do, we'll boil the milk at the 50 degrees Celsius, and suddenly we'll cool down the milk. So that process only, this one 50 degree for 20 minutes. We're going to boil the milk. After that, it's called as pasteurization process. If it is there is a pasteurization process is perfectly happen means the phosphate test will be negative. So sixth one will be tourniquet test. Tourniquet test done for the dengue. If the patient is you're suspecting the patient has dengue, perform the tourniquet test. What we'll do usually in a tourniquet test, we'll tie the tourniquet, we'll tie the PP cuff to the arm of the patient. Then what we'll do, we'll inflate the cuff. After inflating cuff, if there is ecchymosis, if there is perfusa, if there is hemorrhagic rashes on the forearm, means it's considered as positive tourniquet test for the dengue. Positive tourniquet test. If there is any hemorrhagic rashes, if there is any hemorrhagic rashes are present means. So what they will check now? Here they will check the capillary fragility. Capillary fragility is tested here. Capillary fragility means if there is especially dengue will try to damage your platelets. So platelet counts will be very less in a dengue. If you see dengue, there will be a thrombocytopenia. So what to do in a thrombocytopenia? The capillaries have become very fragile and start to bleed. So that's why there will be a hemorrhagic rashes or hemorrhagic purpura will be there when you tie a cuff over the arm. That is what your tourniquet test. And in case of dengue, always keep in mind that tourniquet test is done for the dengue. And next one, seventh test, that is your Schilling test. Don't confuse with the Schilling test and the Schick test. Should be clear. Okay, always be clear with the concept of test called as Schick test and Schilling test. Schick test is done for the diphtheria. Schilling test is done for the vitamin B12. Schilling test is done for vitamin B12 levels. If there is any problem with the vitamin B12 absorption, mainly the vitamin B12 absorption, they want to check in the Schilling test. So how you perform, sir? How you perform? If you ask me, sir, how you perform the Schilling test means it's very easy test, very simple test. It's done in case of absorption defect of the vitamin B12. So how you perform the test? We'll give the patient a radio labeled. Give the patient with a radio labeled vitamin B12 and normal, okay, normal vitamin B12, and we ask this patient to swallow that vitamin B12. After swallowing, if it is okay, if you are GIT, if your gastro, if your stomach, okay, will be having an intrinsic factor. If it is having intrinsic factor, if it is having intrinsic factor, it will bind, okay, it will bind to the intrinsic factor along with the vitamin B12 will be binded and it will be utilized in the body. If it's there, okay, if it is the deficiency of intrinsic factor, what will happen? This radio labeled vitamin B12 will be excreted to the intestine. Okay, will go to intestine, then it will absorb into the intestine, then it will be released into the urine. There will be more urine vitamin B12 levels in case of intrinsic factor deficiency or any damage to your gastrointestinal cells. So what you will do, we'll check the urine vitamin B12 level after giving the orally labeled vitamin B12s. That's how we can do the chilling test. And next, eight test will be a Dick test. Okay, Dick test means it is done in case of scarlet fever. Scarlet fever. Here what you will do, we'll give a, it is results on subcutaneous skin reaction only. We'll give scarlet toxin. We'll administer the scarlet toxin 0.1 ml, 0.1 ml intradermally. Then we'll watch for the induration, swelling and erythema. If induration erythema is more than a 5 mm, consider as positive sick test. That's what your Dick test is means. The ninth one will be Rodira's test. Rodira test. What we will do in Rodira's test? Here we'll check the urine for ketone bodies. Urine for ketone bodies. Here what we'll do? We'll take the 5 ml of urine sample in a urical bottle. Then we will be having the strip will be available. We'll dip that urine strip into the urine, and what will happen after that? There will be color changes. We have to measure the color changes with the calorimeter. Then we can say how much is the ketone now present in your urine. And next one, ninth test, that is your Hay test. What do you mean by Hay test? Hay test is done in case of to check the bilirubin level. Okay, bile salt in a urine. Especially they will check the concentration of bile salts in a urine. In case of this test is done in case of your chronic liver disease and bilirubin hyperbilirubinemia, jaundice. They are going to perform the Hay test. In Hay test, what we'll do, we'll check the what I told. We will check the urine for bile salts. Especially, we'll check the bile salt. In Smith test, 10th test will be a Smith test. In Smith test, what we'll check the here also we'll check the urine. We'll take the urine sample in a nickel bottle and we'll check the urine for bile pigment. Same thing, same like in chronic kidney disease, chronic liver disease, in our hepatobiliary disorders, in a liver cirrhosis, in a hyperbilirubinemia level, in a jaundice and all, we'll check the bile pigment in your urine. Here we'll check the not bile salt, we'll check the bile pigments in a urine sample. That is called as Smith test. 11th test will be a Benedict test. In a Benedict test, what you'll do, I think everyone will be aware of the Benedict test. इसमें क्या करता है कि कुछ नहीं, जस्ट यूरिन को लेता है in a glass container and then we'll boil the urine. उसके बाद में हम measure करते हैं urine with the color changes with the strips, orange, brisk red, green, like color will be there. You can able to check the amount of urine in the amount of glucose in a urine. Especially, okay, here what will check, I told you, here what will check urine for glucose. Done to diagnose the diabetes mellitus. Diabetes mellitus. And 12th important test, that is QIM test. QIM test, what you will do in QIM test is done to diagnose very important granulomatous disease, that is your sarcoidosis. Sarcoid is a protein. Sarcoid is a protein produced by the liver and the spleen. What he will do here, he will take the sarcoid protein and will inject intradermally, then we'll watch for the granulomatous reaction. We'll watch for the granulomatous reaction around the injection site. If it is there, if there is a granulomatous reaction like this means it's indicate positive Quim test. Positive Quim test nothing but patient is having the sarcoidosis. And 13th biochemical test, that is your direct Quim test. Direct Quim test. Here what we will do here to check the autoimmune disorders, or for the hemolytic reactions, we want to perform the direct Quim test. Direct hemolytic reactions, disorders. We can do the direct Quim test. Here what we will do here this one is an antibody which is attached to the RBC molecule. Okay, it is attached to RBC cell. We will going to check the antibody. Okay, here what we are doing here, checking the antibody attached with the RBC. This is called as direct Quim test. And one more test is there, that is indirect Quim test. In indirect Quim test, what we will do, we will check the, here this one is an indirect Quim test. Here this one is an antibody. Consider this one as an antibody, and this one is an RBC. But here what we will do, we will add a reagent. We'll add the Quim's reagent. And we'll check the only antibody like joined with the reagent. Means we are not checking here directly the RBC bound antibody. We are checking the free antibodies. Okay, free antibodies. So this test, indirect Quim test, is done in case of to check the prenatal. Okay, prenatal disorders like erythroblastosis fetalis, EBF, erythroblastosis fetal, RH nothing but RH isoimmunization. That condition we want to perform the indirect Quim test. Means we will check the mother blood for the antibody, free antibody circulating for the opposite to the RH antigen. That is the test we are done in case of RH isoimmunization or erythroblastosis fetalis, indirect Quim test. And 15 test will be your Jagger test and the Snellen chart. Why I am taken this two Jagger chart and a Snellen chart means this both are interrelated. In both Jagger test and the Snellen test, what you will do? We'll check the visual acuity is checked here. Visual acuity is tested in a Jagger and the Snellen chart. Sorry, Snellen test. In Jagger test is specifically meant for nearsightedness. Specifically to check the nearsightedness. Snellen chart is for vision defect. For vision defects. Usually, if you go to the eye hospital, ophthalmological hospital means first they will give you Snellen chart and Jagger chart, and then they will tell you to read out the alphabet or spellings. Here, what will happen? Normal our normal nearsightedness vision, nearest sight of vision will be 20 centimeter. If the person is cannot able to read out the object which is present in a 20 centimeter away, that is called considered as for loss of nearsightedness. Or else we can call that one as hyperopias. In hyperopias, we'll do the Jagger test. Snellen chart is for far vision. That is called as myopia. For myopia, we perform the Snellen chart. Normal Snellen chart, the score will be 20 out of 200. Means the person can able to read out the object from the 20 by 20 vision. 20 by 20. or 6 by 6 is a normal value for your Snellen chart. Means the normal average person can able to read out the alphabet within a 6 meter distance. Within the 6 meter distance, object can be read out by the normal person. If they cannot able to read out, we will call that one as blindness. There are different type of blindness. Are there legal blindness, occupational blindness, and the complete blindness. 17th test will be a Histira chart. What do you mean by Histira chart? Okay, as name itself is having colorful Histira. Histira means it is done for color blindness. It is done for color blindness. For checking the color side, okay, for checking the color blindness of the patient, we're going to perform the Histira chart. It will be having book, okay. I'm taking up only one page of the book. It will be having a book with contents all color, and center they will be written with the will be written with the numbers. Center numbers will be written. We'll tell the patient, we'll give that book to the patient, and we'll tell the patient to read out the numbers present, numbers written in center of the plate, center of the pages. So here if you see, we all are not having any color blindness. So I can clearly point out here they written the 74 number. 74 number is written here. So I am not having the color blindness. If the person is specifically, if the this some color is not written, some color is cannot able to identify, cannot able to read out the alphabet, means we call the person is having this particular color blindness. And 17th one will be a confrontation test. Confrontation test. Here what you will check? Here they will check the specifically visual field. They are going to check in a confrontational test. Visual field is tested. Especially central vision and peripheral vision is tested here. What they will test in a confrontational test? They will check the central vision and the peripheral vision, and the peripheral vision is tested in confrontational test, especially visual field. Okay, here we are checking the visual field, how much was the person can able to see the from the central, from the periphery to center, how much the coverage is there. So here what will do, the examiner will stand opposite to the patient, and patient will examiner will close the right hand, and the examiner will close right hand. We ask the patient to close left eye, and then we'll keep on pen. We'll tell the patient to watch for the pen movement, and until the patient will feel the pen, like can able to see the pen, and examiner will be able to see the pen, means that till that patient will be having peripheral vision and central vision. That's how we can check the confrontational test for the visual field, especially to diagnose the hemianopenia, like right hemianopenias and all. To check that one only, we're going to do a confrontational test. 28 test will be a rollover test. Rollover means rollover test, and one more rollover maneuver is there, that is done in case of shoulder dystocia and all. So it is something related to the OBG. Something related to the OBG means here this one test done to diagnose the PIH. What do you mean by PIH? What do you mean by PIH? PIH thing, but pregnancy pregnancy induced hypertension. Pregnancy induced hypertension. For PIH only, they will do a rollover test. Means we'll ask the person, we'll take the BP once on, we'll check the measure the BP once on standing, once on sleeping supine, and once on we'll tell the patient to turn to left lateral or right lateral position, left or right lateral position. After the patient will turn to supine to left or right lateral position, there will be increase in BP. There will be increase in BP of 20 mmHg, because while supine there will be a compression on aorta, there will be compression of inferior vena cava, so venous rate will be very less. So BP will be dropping in supine position. So what will happen in when the patient will suddenly turn to left lateral or right lateral, they will be relieving out that compression on a inferior vena cava. So there is increase in the 20 to 30 mmHg of BP. So this will that helpful in diagnosis of pregnancy induced hypertension. And one more test, that is your Fern test. Fern test or nitrogen test, both are same. These are done in case of premature rupture of membranes. PROM will do the Fern test or the nitrazine test. Here what we will do here, this one is a Fern like structure. You can able to see Fern like structure. This indicate this amniotic fluid is will be fern like structure, will be having a fern like structure, means if there is a leak, there is a leak of amniotic fluid means the vaginal sample, the vaginal vaginal swab will be having ferns, will be having the ferns present under the microscopy. Under the microscopy, you are able to see the ferns that indicate microscopy. So able to see the ferns mean that is called as to check the whether the membranes are ruptured or not, whether there is a premature rupture of the membranes are there, means to check that one only we are going to perform the fern test or the nitrogen test. And next test, so especially fern test and nitrogen test both are same, and which are done for the checking premature rupture of the membranes. 22 will be 22nd test will be VMA test. VMA nothing but vinyl vinyl mandelic acid. These are the product of VMA nothing but it is a product, it is a product of, it's a metabolic product. It is a metabolic product of catecholamines. Product of catecholamines. Catecholamines. Can you give me example for catecholamines? Does anybody knows what are catecholamines means? Or like examples for catecholamines? See, nothing. Catecholamines is nothing but they are your norepinephrine, epinephrine, dopamine, dobutamine. These all are considered as catecholamines. Means the chemical name for the inotropes is called as catecholamines. These are released specially from the adrenal medulla. Adrenal medulla is going to produce the catecholamines. That is all your various catecholamines, emergency hormones. Noradrenaline, adrenaline, dopamine, all these are produced from the adrenal medulla. So adrenal medulla, it will be releasing a catecholamine that after that it will be converting to the norepinephrine, epinephrine and the dopamine. So after the function will finish, the noradrenaline function will finish. Then after utilizing the metabolism of the epinephrine and dopamine, they will be releasing of end product called as vinyl mandelic acid, and one more is there. One more is the end product of catecholamine, that is your metanephrines. Metanephrine. But metanephrines will be present in blood or a plasma. They will be present in your plasma or the blood. So if you want to check the metanephrine levels, means should take the blood sample and you should look for the serum metanephrine levels. If it is increased, it indicates there is a catecholamine surge in our body. Means there is too much of production of catecholamines, too much release of epinephrine, norepinephrine, dopamine. So that will automatically lead to hypertensive crisis, hypertensive emergencies. So this should be diagnosed early and to rule out the any adrenal medulla tumors. Okay, what do you mean by adrenal? Can you give me example? Can you give me example for the adrenal medulla tumors? Okay, here is example. Here is example. That is your pheocytochroma. Pheocytochroma. Pheo means your phenylephrine nothing but your catecholamines. Cyto means tumor. Chroma means color cell. Chromaffin cells. Chromaffin cells are the color cells. Color cells of your adrenal medulla. Adrenal medulla. So if anybody asks you what does actually the VMA means, what does vinyl mandelic acid test done for? So you should answer it as it is a test done to diagnose the adrenal medulla tumors. That is your pheocytochroma. Pheocytochroma. They will do a VMA test, or they can do a metanephrine levels. They can check the plasma metanephrine levels also. They can do. If they are asking you plasma metanephrine levels are tested in case of pheocytochroma, and VMA also they will do. But in VMA we will check the VMA for urines. Okay, VMA for urines, and your metanephrines for your blood plasmas. 23rd test, that is your water deprivation test. What do you mean by water deprivation test? As here, if you just read out the English, what they written, water deprivation means we are cutting down the water. We are not giving the water for the patient. We are not giving the water for the patient. We are restricting the any kind of fluids. Okay, what we are restricting here? We are restricting the fluid intake. Restriction of any kind of fluid intake. If you're not giving the fluid intake, normally what will happen? Normally what will happen? There will be a drop in urine output. There will be a reduced urine output. There will be a drop in urine output. But in case of diabetes insipidus, what will happen? Diabetes insipidus. What will happen here? Diabetes insipidus. Does anybody answer? Like, what do you mean by diabetes insipidus? What is the problem here? What is the exact cause here? Insipidus. What is the problem here? Problem in diabetes insipidus? There is no release of, okay, there is no release of ADH. There is a defect in your hypothalamus. There may be defect in your hypothalamus. There may be defect in your posterior pituitary. There may be defect in your kidney. So to rule out the, like, whether it is a central diabetes insipidus or nephrogenic diabetes insipidus, to rule out, differentiate between the like types of diabetes insipidus, they are going to do a water deprivation test. Here what will happen? We are restricting the fluid intake for the patient. So there normally that we are expecting reduced urine output. But if the urine output is not reducing, if the urine output is not reducing, if the urine output is continue to increase, normally if it is start to increase our urine output, if even though after you are restricting the fluid intake, so what we call it one as we call this one as your kidney cells, your brain cells are not producing the oxytocin, or else ADH, or antidiuretic hormone, or vasopressin is not able to produce by the posterior pituitary. So that is to diagnose the central diabetes insipidus or nephrogenic diabetes insipidus. We want to do a water deprivation test. 24th will be water loading test. What we are loading here? We are loading the water. Nothing but we are loading the fluids. What we are loading? We are loading the fluids here. In the manner of we are giving the fluids by the orally. If the patient is able to take means we can give orally, or else we can give the IV fluids. We can give normal saline or any crystals. We can give, can load the patient, and after loading, normally if you are taking the more water, what will happen? There is a production of more urine output. There will be a more urine output will be poured out. There will increase the urine output. That is normally. I'm telling that is normally. If in case of patient is having SIADH, SIADH means syndrome inappropriate of ADH. ADH is a vasopressin. It's also called as vasopressin, means antidiuretic hormone. Antidiuretic hormone means it will prevent the diuresis. If there is excess amount of ADH is there, if there is excess ADH is there, means there will be reduced urine output. There will be a oliguria. That to check only we are going to do a water loading test. Even after loading the water, after loading the fluids orally or IV fluids, the urine output will not increase. There will be a same or reduced urine output only will be seen in case of, if it is a case of SIDH, there will be no increase in the urine output. That is what is called as positive water loading test. And 20 will be this one is related to your OBGYN test, that is your triple test or triple marker. Normally we'll say triple marker. Double marker, triple marker, quadruple markers. Okay, that are the biochemical test, triple marker. Especially this triple marker, double marker, quadruple marker, this all three tests are done to diagnose the chromosomal abnormalities. Chromosomal abnormality in a first trimester. This all tests are done in a first trimester. If there is any chromosomal deformity like Down syndrome, Patau syndrome, Edwards syndrome, we try to terminate the pregnancy, or we try to abort the pregnancy, because it all a fatal condition. The fetus is going to develop as abnormal. In the first trimester, we're going to perform the triple test. Triple test to diagnose what? For why we're going to do the triple test? To diagnose chromosomal abnormalities. Chromosomal abnormalities, especially Down syndrome, Down syndrome, Edward syndrome, Patau syndrome. This all syndrome. If you want to diagnose chromosomal abnormalities, we should do a double test, quadruple test, and a triple test. We'll see what are the components will be added in a. We'll check in a triple marker test. First one, I made a mnemonic called as a high energy. A high energy means A means AFP. A means AFP. What do you mean by AFP? Alpha fetopoietin. AFP means alpha fetopoietin. A healthy. H means HCG. H means HCG. What do you mean by HCG? Beta HCG. HCG nothing but beta human chorionic gonadotropin. Gonadotropin. Beta HCG and E for E3. Estratriol. Okay, estratriol. Tri means three. Triol, estratriol. These three are done in a triple marker test that is done in first trimester to diagnose the chromosomal abnormalities like a Down syndrome, Edward syndrome, and the Patau syndromes. So 25th question question will be test will be quadruple test. I told you we'll do a double marker, triple marker, and quadruple marker. In quadruple markers, in what all components are added? AFP same only AFP alpha fetopoietin, H for beta HCG, H for beta HCG, E for E3, nothing but estratriol. Tri means tree triol. I, okay, one more added, that is your inhibin is added, okay, inhibited, a high energy. When you are very young, you will be having high energy. So after the age will come down, after age will progress, you will be having inhibited energy. Your energy will be lost, your interest will be lost. So inhibin is added here. In a quadruple test is inhibin A is added. Inhibin A is added in a quadruple test as a specialty. These three alpha fetoprotein, HCG and E3 will be component of our triple marker. And now we'll see like last one, that is our double marker. Double marker what are added? Here we are adding the beta HCG. One beta HCG is there and one more P for Papa. PA. Papa means pregnancy associated purified protein A. Purified protein A. PA. PA. Purified pregnancy associated purified protein A. All of you got that? What does actually mean by double marker, triple marker, and quadruple marker? Double marker nothing but HP. Remember as HP. Double marker HP. H means beta HCG. P means purified protein pregnancy associated purified protein A. And triple marker we are having A high energy. A means alpha fetoprotein. H means beta HCG. E means estratriol E3. Quadruple marker we are just adding the inhibin A high energy inhibited. And next test will be your 27th test, that is your Brody Trendelenburg test. There are two Trendelenburg tests are there, so don't confuse with the two of them. Trendelenburg test, one will be plain Trendelenburg, another will be Trendelenburg test Brody is a scientist name. They added to reduce the confusion. In a normal Trendelenburg test, Brody, what they'll do, they will tie the cuff or tourniquet to the thigh of the patient, and they will rise the foot end. Then they will see the venous filling. They will see the venous filling. If there is any tortuous abnormal venous filling is there, means we consider this one as a varicose vein. Okay, this is to take so ultimately it's done to test the varicose vein. It's ultimately done to check the varicose vein. In case of what condition they will do a Trendelenburg test. They will do a Trendelenburg test to check the venous insufficiency disorders. Venous insufficiency disorders. They're going to perform the Trendelenburg test. In case of varicositis, in case of your venous disorders, peripheral vascular disorders, venous disorder, they're going to perform the Trendelenburg test Brody. And 28th test will be a plain Trendelenburg test. What they will do, this one is actually, we ask the person to like stand and walk in a straight line. So after sitting, if you see any drop in a hip, okay, drip is, your hip is getting inclined, means we call that one as abductor Trendelenburg test, positive Trendelenburg test, which is helpful in diagnosis the hip disorder. Hip disorder. If disorder, we going to do a Trendelenburg test. If the see, this one is a normal, your hip bone. If here any hip drop is there, any inclination of hip while walking in a straight line, we call that one as positive Trendelenburg test. 29th will be a Fallon test, and also called as tunnel test. T for tunnel, or tunnel. So what does actually mean by funnel test or a tunnel test? I told you funnel or tunnel. Something is common here. That is tunnel. So this test is done to check the carpal tunnel syndrome. Carpal tunnel syndrome. What will happen in a carpal tunnel syndrome? There will be a compression of median nerve. There will be compression of median nerve in a wrist. If normally, like those who will be sitting in a computer and they'll be working now, they'll be having the carpal tunnel syndrome. To check the median nerve compression, what we'll do, we'll tell the patient with the elbow and the wrist flexion will do. Okay, up to 60 degree, 70 degree, we'll do a wrist flexion and the elbow flexion. After doing this wrist flexion and the elbow flexion, there will be a compression over the median nerve. If there is any numbness, any severe pain is present in your wrist, means we call that one as positive Fallon test. Means the patient is having the carpal tunnel syndrome. Normally, if I am doing the hip flexion, if I'm doing the elbow flexion and the wrist flexion, I'm not feeling any pain or numbness, anything. But if you do this test in a carpal tunnel patient, means there will be a compression of the middle nerve. There will be a pain and numbness will be felt in a ribs, felt in a hand. To check the compression over the median nerve, we want to perform the funnel test. Median nerve. So always keep in mind that funnel, tunnel. So lastly, funnel, Fallon, tunnel. So all three are synonymous. So carpal tunnel syndrome, they're going to perform Fallon test or tunnel test. 38th will be gold quantiferon test. Here what gold means? Gold means nowadays TB is like very popular. TB is getting more incidence of TB. So gold means gold quantiferon test is done to check the TB, IGRA. What do you mean by IGRA? IGRA is nothing but interferon gamma releasing assay. Interferon gamma releasing assay. So this test is done to check whether it is a past TB or present TB. Means they are going to check the antibodies for the TB. Antibodies are tested in a IGRA test or a gold quantiferon test. So past TB or present TB, we want to differentiate. So that's why we want to do a gold quantiferon test. 31th will be a bangle test. Bangle, as name itself says, bangle. We are having a bangle here. 4 mm of bangle will be present. This is test used for up to 5 years of children. Up to 5 years of children, we can perform the bangle test. Where the Shaki tape is not available, that time what we will do, 4 bangles will be available. We'll insert the bangle up to the arm. If the bangle is can able to cross the mid upper arm, if it is able to cross the mid upper arm, we call that one as positive bangle test. So it is present in case of malnutrition. Malnutrition. If there is any malnutrition, there is a chance of positive bangle test. And some babies and your kwashiorkor marasmus, this test will be a positive. And 32 will be a knee case test. Knee case test means if you see the image, you can able to clearly watch that one. The patient, the child is touching the knee with the extended knee. He's bending the neck and is kissing the knees. If this one test is done for meningitis, for knuckle rigidity, for especially to check the knuckle rigidity. If the patient can able to easily kiss the knees, then knuckle rigidity is not there. That indicate negative meningitis sign. See, if you see meningitis, it is always like irritating to the meningeal covering of the vein. When there is a change in a position, okay, when there is a change, when you extend the neck, when you flex the neck, what will happen? What will happen? The angle, the subarachnoid matter will be compressed. So there will no drainage of the CSF. If you see meningitis, already CSF will be very too much, and your intracranial pressure, your ICP will be raised. Always ICP will be raised. If you again extend flex the neck, means what will happen? There will be a sudden increase in IPs. The patient will be having sudden burst of pain. Neurogenic pain will be there, and suddenly will try to extend his neck. So that's what your positive the knee kiss test. Okay, especially they will check the knuckle rigidity. If the person can able to easily bend the neck and he can able to touch the knee, means it's called as negative knee test. If the baby or child he cannot able to touch the knee, means it is called as positive knee test. 33 will be Tizang test. In 2022, NORCET they asked the Tizang smear test. Tizang smear test. This is done in case of scabies, or itch mite. We can say itch mite. Here what they will do, they will take they will scratch. Okay, what they will do, they will scratch the base of the lesion. They will scratch the base of the lesion. They will scratch the base of the itch mite lesion. Then they will do a then they will check. Then they will prepare that smear, and they will study under the microscopy. They will study under the microscopy. If there is any lesion like this, pemphigus lesion, as there means sorry. This T-Junk smear is done in case of various skin disorders. Okay, to check the not in itch mite, it's done to check the various skin disorders. Your dermatological disorder, various skin disorders. They're going to do a T-Junk smear test. Here, what they will do, same base of the lesion. They will scratch the base of the lesion is scratched with the glass slide. Then they will add the KOH mount, potassium hydroxide mount. They will add to the slide. Then they will watch the slide. Okay, then they will keep the slide under the microscope, and they will see the and they will see the lesion, if that is okay. This one is specially done for the pemphigus vulgaris, pemphigus disease, bullous dermatological disorder, and herpetiform disorders. This T-Zang smear is done. Here they written pemphigus vulgaris they will do, pemphigus folliculus they will do, and multinuclear giant cells seen in case of your psoriasis, and leishmaniasis. These are the LD bodies are seen in case of leishmaniasis. This all are the result of the T-Zang smear. And 34th will be Boni Marshall. Okay, Boni or Marshall test. Boni or Marshall test. Sean Marshall. Marshall means there is something stress. Boni, Marshall, stress test, also called as stress test. Here, what we will do, if the person is having any incontinency, urine incontinency, you wanted to check the urine incontinency, what you will do, you will perform the Boni or a very simple Marshall test. What we'll do, we'll ask the person to, if we'll give the patient for a fluid, and then after that, we'll tell the patient to cough excessively. If the patient is coughing, that time if any leak of urine is there, means we call that one as stress incontinency. To diagnose urine incontinency, we're going to perform the Boni test. Next one will be your orthodolin test. Orthodolin test is done to check the chlorination. Is done to check the chlorination of the water. Orthodolin test. By using the orthodolin reagent, they will perform the orthodolin test. What they will do, if the water is there, 10 liters of water is there, they will add the orthodolin reagent. If it is absorbing the chlorine, means that is considered as how much percentage absorbing, it indicates that much amount of chlorination of water is done. Then 36th one will be a Rubin test. Nowadays we are not performing the Rubin test because it is very dangerous for the fallopian tube. Here what we'll check in a fallopian, we are going to check the fallopian tube patency. How these tests are done, how these Rubin tests are done. We'll put a uterus guide, like through the cervical canal. We'll put a scopy. Then we'll give the gas. We'll give the injection of gas. Then we'll see the tube is inflating or not. There is a sufficient amount of tube suppletion is there not or not, or is there or not. We'll check through the Rubin test. This test is always not performed. Instead of this test, we are performing the HSG. HSG. What do you mean by HSG? Hysterosalpingography. Hysterosalpingography means under the serial X-rays, we will take the continuous X-rays and we'll push the dye inside the cervical canal. When we'll see whether the dye is coming out of the fallopian tube or not. Here to diagnose, okay, this Rubin test is to done the diagnosis of tubal block, fallopian tubal block, fallopian tubal block. Going to perform the Rubin test. Next will be dexamethasone test. Dexamethasone test nothing but dexamethasone suppression test. Dexamethasone suppression test. Which case we're going to perform this one? We're going to perform this one is Cushing disorder. Okay, Cushing syndrome. We're going to do a dexamethasone suppression test. What we'll do, we'll give an injection 8 mg dexamethasone IV. After that 6 hours, we're going to check the serum cortisol levels. Okay, if it isn't Cushing syndrome or Cushing syndrome or Cushing syndrome or Cushing disease, we want to check the difference whether it is a Cushing disease or Cushing syndrome. For that only, we're going to do a dexamethasone suppression test. And next one will be a creatine clearance rate. It is very, very important for giving the drugs. If you want to give the drugs, if you want to give the loading dose, booster dose, okay, if you want to give the antibiotics, you want to give the nephrotoxic drugs, that time you should check the always creatine clearance rate. There is a formula, okay, there are formulas are available for checking the creatine clearance rate. One among them will be based on, so formula for checking the creatine clearance rate is 140 minus year, age in years, okay, minus age in years divided by 72 into serum creatine level. That is a formula for checking the creatine clearance. This is for checking the creatine clearance rate. Normal creatine clearance rate will be 90 to 130 ml per minute. That is a creatine clearance rate. Normal 99 to 130 ml per minute is a normal creatine clearance rate. If it is reduced, creatine clearance rate is reduced means We can give a renal modified dose. Next will be a Wood's slit lamp test. This is done to check the dermatological disorders. Especially what we'll use here, we'll use the dermatological disorders. For assessing the dermatological disorders, we'll do a Wood's slit lamp test. What you'll do, you'll use the UV light. Okay, here we're going to use the UV lights for checking the dermatological disorders. 41th last one, Barrow ink test. I told you this one is a 2022 NORCET. They asked about the Barrow ink test. So in this test, they asked in NORCET 22, they asked you, borrowing test done to check, done to diagnose the disease called as like that. This is borrowing test done. If you see borrow ink, what we are doing here, we are applying the ink on the lesion. After that, we'll see whether that each mite is going to observe that ink or not. This one is each mite. Here you can able to see here is the each mite is there. So this is done to diagnose the scabies or itch mite. So along with this 40, this finishes your all important biological tests in a single video note. Thank you for watching it. Please do watch the KNO video channels. Thank you for all for watching the videos.